Happy Monday, everybody. It's Dr. Leslie Apgar coming at you live from Greenhouse Wellness. It's our Medical Monday, and today we have the fabulous Josh Rosenbloom, DO, who is here, and we're going to talk about all things GI, and we're going to talk about cannabis. So welcome, Josh.
Thank you for having me.
So tell us, how did you get here? Where did you come from? How did you land in Maryland?
Sure. I just completed my fellowship in gastroenterology.
Mm-hmm.
We were in Michigan for the last 8 years. I was completing my fellowship there as well as my residency in internal medicine.
Mm-hmm.
Prior to that, I went to medical school in Des Moines University. And prior to that, I grew up in Silver Spring, Maryland.
So you're back home?
Back home, did full circle.
Nice. And your special interest is in inflammatory bowel disease, or?
Inflammatory bowel disease, but really anything in the GI tract. We're general gastroenterologists, so we're primarily looking at things like screening colonoscopies, but also we do a good bit of focus on inflammatory bowel disease.
Okay, and you have a couple of practice locations, you said?
Yes, we're in Columbia and in Olney.
Okay, so as far as cannabis goes, you have just entered this space as you are now a provider.
Yes,
you're certifying your patients.
Yep.
And you said that you're also open to new patients. If you have patients that have GI issues, say, and are looking maybe to get into the cannabis space, you would be amenable to seeing them?
Absolutely. Primarily, like I was previously mentioning, we do a good bit of focus on inflammatory bowel disease. That's kind of an all-encompassing term for both Crohn's disease as well as ulcerative colitis. Good bit of our Crohn's patients have a lot of difficulty with pain management and other symptoms that they're unable to really just manage on a regular basis, and we're definitely using and encouraging medical marijuana or cannabis as an adjunct therapy to their traditional therapy that they're already on.
So a lot of these patients can be on a lot of different medications and the immune suppressant drugs, et cetera, et cetera. You see a lot of suffering, I'm imagining.
Absolutely. And even when they're potentially being treated appropriately, they're still having difficulty managing their symptoms.
So they have problems maybe maintaining their weight, they're anemic from...
Absolutely. So a lot of these patients are having, like I said, recurrent pain. They're unable to eat, they're nauseated. In addition, they're having change in their bowel habits. So most of the time it's more like a diarrhea or a more frequent bowel habit pattern.
Mm-hmm. Great. So what do you see the benefit of medical cannabis in these particular patients being?
Yeah, so I think it's kind of like a three-part approach to it. With our Crohn's patients, I think there's one primary aspect specifically from like a symptom management, like I previously mentioned. We need to get their symptoms under good control. And I think that there's no question that this is a good option for symptom management, both from a pain perspective and just an overall relief, even if it's of their anxiety, etc. Now, I think there's also another component, which is the anti-inflammatory component to it that I also briefly mentioned on. So I think there's really not that many studies that have been done in general, in medical marijuana specifically, really across the board, but specifically in the gastroenterology field, primarily because it's been a Schedule I substance and they haven't done the necessary studies that are appropriate. There are a couple of studies, and regardless, even with anecdotal evidence, it seems like it's clear from a symptom management perspective, it definitely helps. Anti-inflammatory component, I think, is still to some extent up for debate. However, I really do feel strongly that there's definitely a strong anti-inflammatory component behind it. Mm-hmm. And then I think the third component is whether there's like a curative aspect on it.
Right.
And I think that really truly is subject to debate. I'm not saying that there is or there isn't, but some of the studies seem to indicate that it's possible that there is a component. But regardless, as I said before, I'm primarily using as an adjunct to their traditional therapy that they're already on.
Sure. And honestly, we just want our patients to feel better.
Absolutely.
Right? I know there was an article, I think it was 2013, in one of your GI journals. I'm not sure exactly what the title was, but it was basically that patients who were given high THC cannabinoids with Crohn's, 90% of them reported a serious, significant decrease in their symptoms.
Yep.
And I know the article cautioned us to not necessarily extrapolate that a decrease in symptoms equals eradication of lesions on observation or by biopsy.
Sure.
But honestly, we just want our patients to feel better.
Sure.
Right? So I'm sure you have patients anecdotally that have told you, hey, listen, I'm off all my meds. I was just using cannabis, or I'm maintaining to just using cannabis, and I have no more symptoms. And as far as I'm concerned, I'm disease-free. I mean, that's fairly remarkable when your patients tell you this, right?
Absolutely. I mean, the satisfaction that a lot of these patients are getting they're getting such better control of their symptoms. They're living their lives so much more effectively because they are controlling their disease rather than letting the disease control them.
I love that. That is amazing.
Yeah, I mean, ultimately, at the end of the day, that's really all I want is my patients to feel better. Yes, we want to keep the disease under the best control we can, but it's not like we are actually curing the Crohn's disease.
Right.
We are managing it.
Right.
So this is a good way to manage their symptoms. And again, it's not in place of traditional therapy. It's in addition to it. And I think it's also, the side effect profile is far less than almost any other option we're offering.
Right. Such a safe option.
Yeah, to me, if they're managing their symptoms and they're feeling good at the end of the day, what more do I want for my patients?
So I know for me, being here in the dispensary and trying to counsel patients who are coming in, what I would love to see the industry provide would be a tincture that has certain cannabinoids and ratios exactly for inflammatory bowel disease. I would want THC, THCA, which is the acid form, CBD, and CBDA. And I would love to have a 1-to-1 ratio of those 4 major cannabinoids. And then I would love to see limonene and beta-caryophyllene as far as terpenes added that would target the GI anti-spasm and to promote GI motility and things like that. And it's just, we just need science and we need the medical community to sort of catch up to where we are.
Yeah.
But I would love to be able to offer that to patients as a tincture that they could just sort of microdose every day and keep their symptoms at bay, and it wouldn't make them high, and it wouldn't make them intoxicated, and they could live their lives. That's fantastic information, Josh. Hey, listen, I actually do think our viewers might have a question about what the DO means. Like, how is that different than an MD, and how do you approach medicine a little bit differently?
Sure. So I went to what they call an osteopathic school, osteopathic DO versus an MD. Both of us go to standard classic medical schools, but there's a couple of primary differences I would say that make a osteopath's training slightly different than an MD or medical doctor. In school, there's one thing that we learn in addition to the normal classic medical school classes, something called OMT or osteopathic manipulative therapy. In addition to actually learning, via the books and in the anatomy lab, we actually learn to manipulate and treat the body in certain ways. And that kind of goes in line with the thinking that they also push a couple of approaches. They're slightly more in line with the holistic approach, I guess, as you would say. So there's 3 primary things that I would say kind of is based on. One, the body has an innate ability to heal itself.
Love it.
Which is what I think kind of consistently with what we've been saying all along is that you need to help it get there, but the body has an innate ability to heal itself.
Right, and funny enough, the endocannabinoid system, which we're then supplementing with cannabis, is helping the body be at its best and be back into balance so that it can heal itself.
Exactly.
So I love that.
Exactly.
Okay, that's great.
The second thing, I think there's a slightly larger focus on prevention.
I love it.
Which, again, my whole field is based on prevention. That's why I went to gastroenterology. I'm doing colonoscopies to prevent cancer. We're the only screening mechanism that prevents cancer.
Get your colonoscopies, people.
I'm not detecting cancer, I'm preventing it.
Right.
I'm cutting out a polyp because I'm preventing cancer.
Yeah, that's nice.
Yeah, and then the third thing I'll say is it's, instead of it being, it is disease focused, but at times I think you're approaching the whole body as a larger approach rather than disease as well.
I love it.
But honestly, after that point, I want to emphasize my residency and my fellowship were in line with exactly what anyone going through any MD program goes.
Sure.
We were duly accredited in both osteopathic and MD. Went through a very high quality and good training and really had no basis after that point. That was really the only difference going forward. And to be honest, in 2020, the AOA and the ACGME, which is the 2 medical training, are actually merging. So it's literally going to be the identical training.
I love it. Well, honestly, I think that we couldn't find a better partner to, bring medical cannabis into the GI community. And I love that you're here and I love the support. And if our patients want to find you, how do they find you?
You can find us in Columbia or in Olney. Our practice is called Gastro Center in Maryland. You can reach us at 410-290-6677, or you can find other information on my page or online at gastroenterologist.com, I believe is the website.
Absolutely fabulous. So if our patients have any questions, we'll go ahead and forward those to you,
Absolutely.
and we'll
Absolutely.
be able to answer them right online. But
Absolutely.
Josh, I cannot thank you enough for coming here.
Thanks
I
for
cannot
having me.
thank you enough for being a part of this. It's amazing.
Thank you for having
Our
me.
patients are lucky to have you.
Thank you for having me.
All right.
All right.
We'll see you.
That's good.
Thanks, guys. We'll see you next week. Bye-bye.